In the study results, what this is compared to the old-fashioned NAF that none of us even knew was happening, the nipple aspirate fluid. They compared it to ductal lavage, and they found 17% of women had these atypical cells. Marked atypia or malignant requires more of a workup, but mild atypia, you don't do anything. You just adjust your risk assessment. And I'm currently plugging it into the models as if it was atypical hyperplasia. That may not be right, but that's what I'm doing right now. But that's the group we're looking for. Unfortunately, this is the can of worms. We're not sure exactly what it means yet because we don't always find cancer in these marked atypias, and that's got to be worked out. But the reason you're doing it is usually women that are straddling the fence. Do I take tamoxifen or not? High-risk women, and then you do and find atypical cells, then that might be the tie. It breaks the tie and puts you more in favor of doing tamoxifen. And so the purpose is selecting patients for chemo prevention. It's not screening, it's not diagnosis, it's risk assessment and risk stratification to select people for tamoxifen. Briefly, it's a 3-step procedure. It's this aspirator put on over the nipple after an anesthetic cream. If no fluid comes out, you're done. That may actually be a predictor of less risk. In fact, if you get fluid alone, there's a small relative risk for breast cancer. It's not huge, but no fluid is actually a good sign, and you don't do the test. If there's fluid, you drop the cannula into the opening, 1 or 2. There it is, sitting in the opening.